Hello, I am Christy Wellings and I am the lead psychologist in Southwark CAMHS, and this is where we see young people who we've been asked to meet with because we've heard typically from their GPs or from school or sometimes from their paediatrician or direct from their family that there are some things that they're finding really tough and that they would like some help with. So we have 3 sites in Southwark CAMHS. Mapother House, which is right on the Maudsley Hospital campus, close to King's, close to Denmark Hill Station. And then we go towards Peckham a little bit and we have Sunshine House, which is where our neurodevelopmental service is based and child health colleagues. And then you go a little bit further towards Peckham and we have the Lister Clinic where our CareLink team is based, and our CareLink team work with children who are looked after by the local authority and sometimes children who are adopted.
We have services that are organised by age. So we have a team that's for under 12s and a team that's for over 12s, and so adolescents. And then we have some teams that are organised more by the type of specialist need that children and people might have. And so we have a CAMHS early help team, which tries to be there, responsive, and provide a sort of early help and early intervention. And also we have a team that in fact sits at King's College Hospital and provides crisis care for those young people who might come via the sort of emergency A&E route, but are in fact in need of mental health support.
We work with children with all sorts of different difficulties, and sometimes that is to do with anxiety, and sometimes it's to do with low mood, or sometimes we would call that depression. Sometimes young people are really struggling with their emotions and the ups and downs, and that can lead to some risky behaviours. And sometimes, particularly younger children, we might see where their distress is coming out in their behaviour that they show, and that's the thing that starts off worrying the people around them. There are all sorts of different things that we do to try to help. So the first thing is to sit down with a child or the young person and the important people around them, so that might be mum, dad, other carers, and try to think together so that we can understand what's going on and to try to make sure that whatever we're doing, it's individualised to the needs of the child, the young person and the family.
You do green. I do green.
And then we offer all sorts of different talking therapies. So we might offer something called cognitive behavioural therapy, family therapy. We might offer something called interpersonal therapy for adolescents. And we also often offer art therapy and drama therapy. Sometimes we work individually. Sometimes we would invite a young person or a parent to a group because we know that sometimes the experience of being with other young people or other parents who are having similar difficulties can be incredibly helpful.
So one of the things we say to young people and their families is that whilst you're waiting to see us here at CAMHS, we usually recommend that you have a look at our website. And at the website we have lots of great resources which ranges from coping strategies that you can learn yourself with a parent. You can also find all the information about your referral, so your referral date and your letter. There might be links to other websites that might be really helpful, or other support networks for families and carers in the region.
Also, it allows you to fill in a series of questionnaires, and those questionnaires are really important because they give us a sort of a finger on the pulse, a bit of information about what things might be difficult and how we may be able to help. And so from time to time, we will ask you to fill those questionnaires again, just to see how things are developing, and it will help us think and prioritise your needs before we finally meet you.
We hope that we make it a really positive experience for you so that you get to know an individual clinician and you feel that somebody is going to listen and that you can trust that we are doing what we can to help make things better for you.
So please do make use of all the resources that are available to you, and we are very, very much looking forward to seeing you soon.